our panelists have talked about how important the obtaining of the molecular profile for the tumor is to help with treatment selection. There's also this competing feeling of this is a really aggressive cancer and we need to start treatment as quickly as possible. And so, um, it was discussed that about 40% of anaplastic thyroid cancers will have a BRAF alteration. And is that using IHC, is it sufficient if you see BRAF V600E, or should you really wait to get next generation sequencing, one, to confirm the BRAF mutation, and second, to see if there are any other alterations? Um, I'll let anyone take this question.
Sure, Dr. Cubb can speak to this more eloquently than me, but from the pathology side, so it's been shown that BRAF IHC is very sensitive and specific. So very reliable in detecting these these BRAF mutations. That said, interpreting an immunohistochemical stain is often challenging, especially in a tumor that's very necrotic. So while if a tumor strongly expresses it, the pathologist who's very familiar with looking at these specimens says it's positive. They tell Dr. Cubb and Dr. Blumberg and Dr. Sheth this is positive. We can be confident. Then I think that that it's very reliable. But there can sometimes be challenges in interpreting these stains, and so getting molecular confirmation I think is still critical a lot of the time.
And it also speaks to, again, being at a center with experience with this and availability. One thing to note is not all centers have a BRAF IHC available in-house. So we typically can get it back within 24 to 48 hours. If it's not in-house, it'll take more like a week typically to be able to get that back. So again, we'll continue to encourage to be at a place that has the tools to be able to get this done quickly. If a BRAF IHC is positive, I would go ahead and go start the process of getting treatment. We do have to still get medications and everything through insurance and everything, so I don't want to give any, it can take a little bit of time, but I would definitely start the process just with that. That being said, I think it's important to be doing all of this at the same time. Like one thing we didn't talk about too much were those 6% of tumors that have these rare fusion mutations. We actually have drugs that specifically target those mutations. So that would change the chemotherapy I would often recommend. So that's why we try to do all of this simultaneously to be able to start one form of treatment or another sooner rather than later.